Thanks.
Thank you, Dr. Fengmin Kan, and for the many challenges that you're proposing and posing to all our participants. And in line with the presentation of Dr. Fengmin Kan, uh, the ISDR, in collaboration with other UN organizations also, like the World Health Organization, has launched initiatives to promote and advance disaster risk reduction. And the initial campaign, um, previous to the one we have right now, and for the last 2 years, was on education. That disaster risk reductions starts or begins at school. Now we have a new campaign, and this is what our next speaker will be elaborating on. And we are very privileged to have with us uh, a director from the World Health Organization Regional Office for Western Pacific, no less than Dr. Linda L. Milan. Dr. Milan is the director of the Division of Building Healthy Communities and Populations, and is also currently acting head of the World Health Organization Western Pacific region. And we're very grateful that she's able to make it in our plenary session in spite of her very, very busy schedule. In fact, after her presentation, she might excuse herself because she said they're undertaking a budget process, a very important process, and her absence might mean no budget or little budget. So, in addition, the work of Dr. Milan in WHO involves facilitating the sustainable development of healthy communities and populations by promoting health throughout the life course, promoting healthy environments, and reducing impact of diseases, and encouraging healthy lifestyles to prevent disease and disability through integrated intersectoral approaches that recognize the stress and stress the links between development, the environment, and health. Dr. Milan also leads a broad range of WHO programs, including gender, women and reproductive health, making pregnancy safer, child and adolescent health, and development, among many. Dr. Milan served as acting WHO representative in the Philippines in a concurrent capacity from September 1998 to August 2002, and from March 1996 to May 1999 as the Regional Advisor in Occupational Health in charge of the programs on occupational health, aging and health, rehabilitation, and prevention of blindness and deafness. Without, and before, can I continue, please? Huh? I would like to introduce Dr. Milan adequately because she was my boss when I was in the Department of Health a decade ago. Before joining WHO in 1995, Dr. Milan was acting Undersecretary or Deputy Minister of Health for Management Services at the Department of Health Philippines. She was also Assistant Secretary of Health for International Health and External Relations and was responsible for promoting, coordinating, and facilitating multilateral and bilateral programs of the Department of Health. From 1988 to 1995, Dr. Milan was actively involved in the work of WHO, a member of the Philippine delegation to both the Regional Committee and the World Health Assembly, and was a member of the Executive Board of WHO from 1993 to 1994. Dr. Milan is a graduate of medicine at the University of the East Ramon Magsaysay Memorial Medical Center. She obtained her Master's of Public Health degree at the University of the Philippines, College of Public Health. She studied international health at the Graduate School in Public Health, San Diego State University, USA, and epidemiology, public health administration at the Ben Gurion University in Israel. It's my pleasure to introduce to you Dr. Linda L. Milan.
Thank you very much, Manny. That was unexpected. As Manny told you, we work together in the Ministry of Health, and maybe he has forgotten to say that his very first exposure to emergency and disaster was through a WHO fellowship when he was sent abroad to study disasters, emergency preparedness. And we are so glad that with people like Manny, we are able to multiply 100-fold what one person or what a staff member of the Ministry of Health could do. So I'm very proud of Manny that he has come this far and has been leading work in emergency and disaster preparedness. So that was a very long introduction. I think Manny could have just mentioned to you that maybe the programs that I cover here in the Western Pacific region that's comprised of 37 countries and areas are programs that are from womb to tomb. So we start from making pregnancy safer, the adolescent, the elderly, until they die, and then the environment in between. And probably all health programs outside of communicable diseases are the program areas that I cover. So, but anyway, I'm very, very happy to be here this morning and to be invited to the 3rd Global Congress of Women in Politics and Governance. I can see a number of faces here I have worked with in the past, and a revelation to me is Remy Ricken. I know that she's such a good manager, a good leader, but I think what she demonstrated this morning is something that I haven't seen when we were working years ago. And Remy, I need to learn from you. This morning I was asked to present, as Manny said, on some overview of the campaign, the World Disaster Reduction Campaign 2008-2009, with the theme Hospitals Safe from Disasters. And since the theme for this 3rd Global Congress is gender in climate change and disaster risk reduction, then towards the end of my presentation, I would like to throw in a bit of some gender issues and considerations when we talk about disaster reduction campaign. Throughout history, human beings have experienced countless disasters, either natural, man-made, or from chemical hazards. But fortunately, with the accumulated knowledge, acquired skills, collective wisdom, and random luck, we as human beings survive. Our countries and families survive,